What's up, everyone? Dr. Kevin, Dr. Rich, that's him, from Restorative Wellness Center, and want to talk with you about a couple of really important things, and that has to deal with concussions, traumatic brain injury, just other neuroinflammatory conditions, and some of the tools that we have here that are able to support and help you. And so Dr. Rich is going to start by chatting a little bit about one of the most important things that we have to offer.
Absolutely. So everybody knows the buzzword concussions, especially over the last couple of years. Professional sports, I'm not going to say anyone in particular, but concussions have been a very big part of mainstream. And it kind of makes sense though. They're common. We see them all the time, all the way from young childhood in sports, outside of sports, auto accidents, just falling all the way up to professional athletes. And so it's important that, especially as chiropractors, Dr. Kevin being functional medicine too, understanding what they are, how they happen, and then what to do about them in particular. And so something at Restorative, while again, we are chiropractors and we love to use chiropractic care to treat concussions, something that really sets us at Restorative apart is this lovely device we have here. So you're probably wondering, what is this kind of small crane looking device with kind of diodes at the end of it?
Three different ones.
Exactly. Yeah. What could this possibly be? You're not going to see one of these really commonly, really routinely. What this is an Arconia low-level laser device, low-level laser therapy. You'll see it, we'll abbreviate it on a lot of our social media posts as LLLT. And when it comes to this guy, so this in particular is a level 2 laser. Okay, they go from grade 1 all the way up to 4. We chose the level 2 specifically because, especially here at Restorative Wellness Center, we like to make sure the treatments that we use are very, very research-backed. And when it comes to something like concussions, you need to be careful. You need to be very particular about the treatments you choose, and we love to use this guy, the LLLT, low-level laser therapy, level 2 laser. Absolutely.
Now, one of the reasons why we want to use a level 2 is when we start getting above into level 3, level 4, you might say, oh, that's more powerful, so you're going to get a better result. The reality is that they are starting to get to be thermogenic. That means they're producing heat. And I don't know about you, but we don't want to scramble the egg. And so when it comes to your brain, heat and the brain don't go together well. And there has to be a constant moving of it. And so this laser does not produce any heat, and through the literature has been shown to be sitting in that therapeutic range of being able to produce maximum anti-inflammatory results. And along with suppressing inflammation within the body, it also has been shown to increase mitochondrial function. And if you remember, the mitochondria are the portion of the cells that are responsible for producing the cellular energy and allowing that cell to have the energy and resources it needs to heal and to do the jobs that that cell wants to do. And any brain injury, I don't care if it's a big one, you get hit by a linebacker, or a small one, you kind of repeated small blows to the head, they all are producing levels of inflammation within the brain. And we talk about this in all different ways, all over the blog and in different portions, but neuroinflammation is at the core of so many different neurological conditions, whether that's autism, Parkinson's, autism spectrum disorder, on and on. If someone's dealing with brain fog and headaches and altered cognition, can't focus, can't think well, just everything's slow in terms of processing or remembering, these are things to be paying attention to. They're not normal. Even if all your friends are having it, might be common, it's not normal, and it shouldn't be that way. And one head injury can easily be then exponentially amplified by a subsequent injury. And that's one thing that we've got to keep in mind. It's not just the rest in a dark room and give it a couple of days. There has to be much more aggressive treatment being given. And the laser is one thing that can be really helpful for that.
And so it's just like Dr. Kevin said, when it comes to treating something like a concussion, previously, several decades ago, it's like you said, they'd throw you in a dark room, say you're going to rest, drink some water, and once the symptoms go away, you'll be great. The problem with that is, though, a lot of people, the symptoms weren't going away. they would go several weeks and they would have kind of these low-grade headaches. They'd be fatigued, so lethargy, just this constant underlying being tired, regardless of how much caffeine or sleep you get. Like I'd mentioned, headaches, migraines, dizziness, they'd even have vertigo, changes in mood, basically becoming much more irritable for situations that previously you'd let just kind of slip under the rug. And so with what Dr. Kevin was saying, when you have these head traumas, regardless if it's small, all the way up to massive head injuries, traumatic brain injuries, you can see within the literature that there are problems that occur even on the biochemical level within the brain and the rest of the body. Because when we have brain inflammation, and this is why it's awesome to be a chiropractor, we understand the connection between the brain and the spinal cord, the central nervous system, and how it affects the rest of the body. And so when you have this inflammation of the brain, the central nervous system, that in essence will induce inflammation in the rest of the body. And so the great thing with the laser is that what it's able to do is when we apply it to people with traumatic brain injuries, concussions, anything like that, we're able to mitigate, eliminate that brain inflammation, the inflamed cascade that's going on, and affect that on a chemical level. And then on top of that, and I think something Dr. Kevin and I really want to talk about especially is how then adding on top of chiropractic care, the purpose of that, what we do in office as chiropractors, in addition to something like laser therapy, what we can do as chiropractors for something like concussions, traumatic brain injuries, and such. And what's important to realize is while we have that biochemical cascade going on, there are also structural inconsistencies, problems that will occur not only with the head, but also the cervical spine, the mid-back, and even down. Anytime you have a drastic change in biomechanics anywhere in your body, we always love to educate our patients on this compensatory patterns, compensating for something.
Yeah.
So for example, you have low back pain, okay? Say it's on the right side. Well, you're gonna shift your body weight to the left off of that because you don't wanna put weight on something that hurts. We shift our hips to the left, okay? Shoulders have to shift back to the right to keep us upright, and our neck basically has to turn right, so we're actually looking straight up and down. This is not a normal biomechanical pattern, okay? I'm supposed to be shifted, hips underneath me, weight centered, neck straight, looking straight ahead. When we have all these massive inconsistencies, that's when you're gonna see further joint restriction, joint dysfunction, pain, et cetera, even more inflammation.
Yep.
And especially when it comes to the neck and the head, whenever you have something like a traumatic brain injury, whether it's from sports, whether it's an auto accident, even just a fall, a big one we see, and a lot of people have dealt with this too, is whiplash. Okay, so whiplash is massively painful and frustrating. And so whiplash, neck injuries, head injuries, a big thing we can do as chiropractors with chiropractic adjustments, soft tissue work, even getting into things like a little bit of functional neurology, my background, is basically retraining spinal joints, especially the cervical spine, the neck, to understand one, proprioception. It's a big word, big buzzword you'll hear whenever we talk about things like head injuries. Proprioception, understanding where the head is in space, so the proper muscles are contracting to stabilize the head, especially when it comes to the upper cervical spine, that kind of suboccipital area right under the base of our skull. Those muscles are densely innervated with proprioceptive nerves, but also receptors that send feedback into the brain, into the skull, especially in a tissue called your dura mater, that can result in migraines, headaches, and a whole host of other neurological problems that are associated with just dysfunction in your neck joints. So as chiropractors, what's the first thing anybody thinks of for chiropractic care? What does a chiropractor do? Adjust.
Yep.
Okay? And that's what we're good at, okay? And we know we're good at that, okay? And we can help you with that. And so basically on top of something like laser, while that's gonna affect deeper down on the chemical level, chiropractic care is going to round that out nicely. So one, we treat deep tissue and inflammation within the body, chiropractic care, chiropractic adjustment, soft tissue to the external structures to support what's going on the inside.
Absolutely. So bottom line, to sum it up, number of different tools here. The chiropractic adjustment coupled with low-level laser therapy are a profound combination for combating and dealing with any brain or head injury that you might sustain, mild or major. And please don't fall into the trap of writing off a mild head injury as something not to be concerned with.
Yes.
There is no such thing. And when someone has a mild one and then a subsequent mild head injury, you start to see patterns of inflammatory cascades can rise, and you can change permanently some of the cells that are within the brain. And that's a whole nother topic we've talked about in some blogs. We'll get into it more at another point. Please know we got a ton of tools to support you, and we are really happy that you have chosen to utilize us here to support you guys in all of your health journey.
Absolutely.
Thanks, everybody.
See ya.